So, hi friends, good morning to all of you. I'm Dr. Anshul Bansal again joining you on this Unacademy platform. In today's YouTube live session, we'll study about some very important must-know images which will be very helpful in your INICET FMG examinations that are coming, and also in your 2022 NEET PG examination, and also for the professional or the university going examinations, because it will help you to understand the things, build your concepts, and correlate with the things that you have read theoretically. So a very important, interesting session, and it will be a rapid revision session. In 2 or 2.5 hours we'll cover around 200 images. Okay, and I'll have another session of this where we cover the remaining half of the images. Okay, so let's start today's session. Currently I am working as an orthopedic house surgeon in SMS Hospital Jaipur, and I have cracked the NEET PG examination last year, that is in 2020 only. These are the various subscription plans available for the NEET PG on Unacademy, and the first one is your Plus subscription. The Plus subscribers will get access to all our live as well as recorded classes. They can access our entire QBank, and they can compete in live tests and quizzes, all of which is formed by the topmost faculty for the NEET PG in India. And also we'll allow the subscribers to log into multiple devices with the same account, so that they can study on any device of their choice at any time. And also for the subscribers who will be subscribing for 12 months or more, we are shortly providing them with a printed notes. While subscribing, you can use my code, that is Anshul B10, to get extra 10% off. The second one and the best one is the Iconic subscription. It is best not only on the Unacademy but across any digital platform in India. And what makes this best is that apart from the things that I have told you earlier, in Extra May you will get the prep ladder and all of the prep ladder, including all of its Q banks, video lectures, rapid revision courses, grand test, etc. And on Unacademy Extra May you will get well structured live batch wise classes, and we have formulated the batches and structured a course in such a way so as to build your basic concept about any topic or subject first, then going into its in depth. And also after every test that you will give, the subscribers will get an individual test assessment sheet, so that they can analyze themselves, yes, this topic or this subject needs more revision, or what are the things that I am missing, what are the type of questions that are being asked, or what are the keywords, key things that are asked repetitively in the questions of previous year's examinations. So all this is very important for cracking any examination and planning your journey. So Iconic subscribers will get all of this, and the Iconic subscribers while subscribing can use my code, that is Anshul B10, to get extra 10% off. Special classes are very special. I always emphasize and tell you to attend these special classes, because they'll give you extra edge over your competitors, and also they'll give you live classroom like feeling, where you can interact with the educators, solve your doubts there and there. You can participate in polls, you can watch these special classes anywhere, anytime. What you have to do, you have to just log into your mobile application of the Unacademy and log in using my code, that is Anshul B10, and both of which are absolutely free. And also you will be provided with the digital notes of the every special class that you will give and sorry, that you will attend, and that too is absolutely free. Our QBank is very effective. Not only it contains 25,000 plus questions, but also it contains everything and anything that you need. Okay, it contains every type of questions, including the uh, recent years papers, previous years paper, or the high yield MCQs. It will cover your entire theory, the instruments, images, recent advances is very important. Clinical based questions, clinical scenarios, x-ray, CTs, MRI, so everything will be covered in this QBank. So please do solve this QBank. And also we have launched a new feature called as raise a hand feature to make our live classes more interactive and to increase the communication between the learners and the educators. You just need to tap on a button and you would digitally raise your hand so that the educator will come to know about your doubt, and you can clear that doubt and query there and there only. Also, we are running a limited time period offer that is only till 10th of November. And in this, if you'll buy any subscription plan of 6 months, you'll get 1 month of that extra absolutely free. Similarly, 12 months pay, 2 months will be free, and for 2 years, that is 24 months, you'll get 4 months of that subscription extra absolutely free. So hurry, this is just a limited time period offer till 10th of November. And also keeping in mind the different sets of students, so we have launched and started a dedicated batch for the NEET PG 2022 aspirants, and also we have started a important clinical case discussions and instruments batch where you can clinically see the things that you have read in the theory, so that you can conceptualize them very well, revise them very well, and remember them. And also it will generate your interest towards your studies and your topic, which is very important. So while subscribing for any of the course and batches, you can use my code, that is Anshul B10, to get extra 10% off. Here are the various subscription plans of a plus as well as the iconic subscriptions, and here you can see that the cost per month decreases significantly if you increase the duration of your course. So please do go for the longer duration of the subscription, and while subscribing for any of the packages, you can use my code, that is Anshul B10, to get extra 10% off. So let's start today's session. So first image is, what is this? This is your osteoma. Osteoma is a benign osteoma. Okay, this is osteoma की image थी वो. This is benign with no premalignant potential, no treatment required. Most common site is your facial bones, the facial and the skull bones, and the most common age group is your young adults. Just यही है आपके काम की बात. Now second one, what is this? This image is of another benign tumor, and it is the X-ray. This is the CT, and this is the MR, and this is osteoid osteoma. Okay, what is this? This is osteoid osteoma. So in osteoid osteoma, here you can see that there will be a central nidus around the area of sclerosis. Okay, this is area of sclerosis, and here you have this central nidus around the area of sclerosis. Okay, so the osteoid osteoma is again a benign tumor with no pre-malignant potential, but here you need to excise the benign tumor. Okay, in osteoma you don't need to excision was not required. Here you need to excise this tumor. Benign tumor होता है. Most common location is your lower limb bones, metaphyseal in origin, and young adults is the most common age group. Now one more important thing, you have this sclerotic margin with central nidus, sorry, in two types of tumors. First is your osteoid osteoma, and second is your osteoblastoma. Then how will you differentiate it? You will differentiate on the basis of size of the central nidus. Okay, if the size is less than 2 centimeter or 20 mm, then it is osteoid osteoma. But if it is more than 20 mm, then remember it will be called as osteoblastoma by just looking into the x-ray. Agar baki rest depends on the history etc also. Okay, so this is very important. Remember this thing. Now this is very important and a common way common image, and same image was given in this year's NEET PG 2021 examination also. And this is nothing but your GCT, that is giant cell tumor, and osteo, also known as osteoclastoma, which is called as misnomer because of the giant cells. Okay, the tumor has nothing to do with the osteoclast. Remember, it is a benign tumor, but the important thing about that, and that makes this tumor ka management very important, is its recurrence rate. Okay, so recurrence is very common. Now most common location is your proximal tibia and distal femur. And one more thing that you need to remember is that it is presented only after fusion of epiphysis. Okay, only after the fusion of epiphysis you will see the GCT. Okay, the radiographically, sorry, radiographically you will see that there will be a lytic soap bubble appearance wala lesion, as you can see. And this will be eccentric in origin. It will never break the cortex, or it will never come into the joint space. सबसे important. And the treatment is depend on the part where the GCT is diagnosed. If it is in the proximal fibula or the distal part of the ulna, so these two are the non-functional part. Okay, agar if we remove them also or excise them also, then बहुत ज़्यादा functions पे, limb functions पे, there will be no effect. So here the treatment of choice will be only excision, whereas in all other parts, excision plus arthroplasty will be your treatment of choice, and also curettage plus, sorry, bone cementing can also be done. And this bone cementing has dual purpose. First of all, it will give the support or to the bone after the curettage or removing of the tumor part has been done. And secondly, जो ज़्यादा important function है is that it has a heat forming effect. So the heat generated will destroy the remnant tumor cells that are that left after the curettage. Okay, remember this thing. Now the question comes ki about the origin. Okay, so remember, most common site or location कोई भी आपसे पूछे तो it will be a metaphysis. But if somebody asks you that from which part do the GCT arise or originate, okay, then you will go for the epiphysis for the origin. Okay, remember this thing. This is the multinucleate giant cells, as you can see in the histopathological slide. Now treatment we have discussed. Now what x-ray is this? This this is your osteosarcoma, and osteosarcoma is very easy to identify. First of all, there will be lytic lesion, plus very important कि there will be sun ray or sunburst appearance. Now what is sun ray or sunburst appearance? See, perosteal reaction happens in many tumors and many diseases, but the periosteal reaction of the osteosarcoma is typically different and identifiable from rest of the other conditions. And what is this? यहाँ पे जो periosteal reaction होती है, it is irregular and intense, and it breaks the cortex and it reaches the soft tissues also here. So the intense periosteal reaction with lytic lesion, especially in the bones of the lower limb, it is the short sign of osteosarcoma. And also grossly you can see that there will be very large tumor and with dilated veins over it, mildly tender and warm to touch, and the origin is metaphyseal. Remember, origin is metaphyseal. There are two types of osteosarcoma, primary and secondary. Primary osteosarcoma means the most common one that we study, and कोई भी कभी भी osteosarcoma या osteogenic sarcoma लिखा हुआ है, consider it as primary only. So most common is primary. It is seen in the young adults age group, and remember that there will be no pre-existing bony lesion or bony disease in that patient. Whereas secondary occurs in the elderly population because there are pre-malignant bony lesions like endoostomas, etc. So this is your secondary osteosarcoma. Now remember, most common tumor of bone is metastasis. Most common malignant bone tumor is your metastasis. Most common primary malignant bone tumor will be your multiple myeloma, and most common primary malignant bone tumor in young adult age group or 20 to 30 years of age group will be osteosarcoma. Remember this. And this is metaphyseal in origin, most common in the bones of the lower limb, distal femur or the proximal tibia, etc. Okay, and histopathologically you will see the pleomorphic cells. Okay, which are not similar in the size with, and mesenchymal in origin hoga tumor. And the treatment में amputation is the treatment of choice, but nowadays there is a newer limb saving surgery where you can excise the tumor and you have to do the wide resection, and the margin is more than 10 centimeter. Okay, and now there are skip areas. Okay, sometimes what happens in most of the cases, in fact, small tumor cells through the canal or the communications inside the bone, they go to the normal areas of the bone also. So to treat them, in case you are doing the limb saving surgery, what you take help of the chemotherapy also. Prognosis is very poor of the osteosarcoma. Okay, here you can see the osteosarcoma, and it can be of various pattern, lytic, sclerotic, or the mixed pattern type of osteosarcoma. Okay, and इसमें से the worst prognosis osteosarcoma is your telangiectatic type. Telangiectatic type of osteosarcoma. Okay, here you can see that whitish gray color का tumor with gritty feeling on cutting. Okay, and large tumor mass with shiny and dilated veins over it. Okay, now what is this? This is your the histopathological slide. This is the gross, and this is your Ewing's sarcoma. Okay, what is this? This is your Ewing sarcoma, and what you are seeing here, this pattern is called as the pseudo rosettes. Okay, why? Because here you can see in the form of a flower or rosette, there is these uniform cells looking like lymphocytes, which are the tumor cells, and इसके बीच में this area is your area of necrosis. Okay, this area is your area of necrosis. Okay, remember this. Now if we'll come to the Ewing sarcoma, it is malignant, more malignant, and with worse prognosis than the osteosarcoma. Age of presentation is a young adults only. Most common site is your pelvis, but if they are in the long bones, they will be diaphyseal. Remember, a very important DD is your chronic osteomyelitis, because here also you will have fever, etc., but you will not have the cloaca, sequestrum, etc. Okay, remember this thing. Now, radiologically, if you'll see, you will have the lytic lesion with Codman's triangle periosteal reaction, जो सब में होती है. But the important thing is that कि it will not have the Sunray appearance. Here, the periosteal reaction जो होगी, the periosteal reaction will be regular in onion, giving the onion peel appearance. Okay, giving the onion peel appearance, that is your Ewing's sarcoma. And the most important thing about it, that this tumor is highly radiosensitive, so radiotherapy is the treatment of choice. But if the tumor is very large, like this in the image given below, then the amputation is the treatment of choice, followed by the radiotherapy. Okay, remember, this is very important about the Ewing sarcoma. Okay, now what is this? This is called as the hemlock sling, used for the pelvic injuries. This is this, and this is your fixator, or called as the pelvic fixator, both used in the pelvic injuries, and that too in the open book type of injury. Marvin tile classification होता है उसमें, the open book unstable type of injury is your के लिए you can do the pelvic fixator. Okay, now this is the blood supply of the neck of the femur, where three arteries are very important. First is the medial circumflex femoral artery. Second is your lateral circumflex femoral artery, and your third is your artery to the ligamentum teres, called as the foveolar artery. And remember, 1 and 2 are the most important one, and these two are interrupted in case of fracture of neck of femur. Okay, now what is this? This is obviously dislocation of the hip, and what? Posterior dislocation of the hip. And here you can see the attitude of the limb, which is adducted, flexed, and internally rotated. Okay, adducted, flexed, and internally rotated. This is your posterior dislocation of the hip. So most common dislocation in the entire body is your shoulder dislocation, and shoulder के अंदर भी anterior dislocation is the most common, and anterior में भी subcoracoid type of dislocation is most common. Now most common hip dislocation is your posterior dislocation, where the head of the femur will be out of the acetabulum cavity and displaced posteriorly, most common due to trauma. And in any type of dislocation, the treatment of choice is your closed reduction. Followed by the maintenance of this reduction in by a traction or sling or slab, and in case of lower limb, traction will be applied. Now maneuvers ke name at least you should know, and the name are that I used is the Bigelow's maneuver and the Watson James Jones maneuver. Okay. Now most common nerve that is injured here is the sciatic nerve. Okay, this you should know. The attitude you should know, and its opposite attitude will be in the anterior dislocation. And remember, very very important, posterior dislocation पे this year in NEET PG 2021 also there was a very simple question, but yes, जिसने पढ़ा था उसके लिए वो बहुत ज़्यादा simple था. So posterior dislocation of hip is very very important. Okay, now what is this? This is your skin traction. This is your skin traction. Okay, and this is your skeletal traction, where you insert a pin called as ST or Steinman's pin into the bone through and through, and from there you attach the pulley system and the entire traction system to give the traction. So this is your skeletal traction. Okay, now we'll come to the very very important fracture neck of femur के classification. There are three classifications and you should know about them all. उससे पहले we will have a very important thing, that is your differentiation between fracture neck of femur and fracture intertrochanteric femur, that is your IT femur. So it is your intracapsular fracture, yani inside it, the fracture is inside the capsule of the hip joint, whereas this is extracapsular. So intracapsular hai, so obviously displacement will be less, signs and symptoms will be less. Both are common in the elderly age group only, whereas the displacement or the signs and symptoms are more in case of IT femur fracture. Neck of femur fracture will never unite, so the treatment of choice is always surgery, whereas IT femur always unite. Okay, so they can be left conservative on traction for 1 to 1.5 months, but there will be stiffness, wasting, dystrophy, etc. बहुत सारे complications होते हैं. So nowadays, if you are asked in the question and given a X-ray or a history of 70-year-old male or female with IT femur, then the treatment of choice will be your PFN, not normal interlocking nail. This will be a PFN, that is proximal femur nailing. Okay, remember this is again very very important. Now we'll come to the classifications of the neck of the femur. So the first one is your anatomical classification, where on the basis of the location or site of the fracture line, they are classified into three types. The fracture which is बिल्कुल near to the head is your subcapital, उससे नीचे transcervical, and the distal most is your basicervical. Here you can see, and remember, the nearer you go to the head, the more are the chances of the avian. Okay, and more worse is the prognosis. Okay, remember this thing. Now second one is your this classification, and what is the name of this classification? It is based on this angle. Okay, and this is called as Powell's angle. So this classification is called as the Powell's classification, where a horizontal straight line from the superior border of the humerus head, you draw this and you connect it with the fracture line, and on the basis of this angle you can classify the fracture neck of the femur. And normally this angle जो होता है, the less this angle, the more will be the chances of avian. Okay, this is your Powell's classification. Okay, now what is this? This is your Gardner's classification, which is the most important classification, and इसमें the classification is based on the rotational displacement. Okay, classification is based on the rotational displacement. Okay, it is of four types. The first type is incomplete, where the fracture line is not complete, not piercing both the cortexes, and it is called as the impacted fracture. Whereas in rest 3 the fracture will be complete, but here the displacement will be absent. Your displacement will be very less, and in fourth type displacement will be more. Okay, so the fracture head will almost lose its contact with the rest of the proximal femur. So this is your type 4 of the neck of the femur. Okay, what is this? This is called your traction table or your fracture table, used for the operations of the IT femur or neck of femur, CC screw, corticocancellous screw if you are doing, or the interlocking nail of the femur, etc., to give the sustained traction. And this is your C-arm machine or the IITV, that is your image intensifier, used to have the real-time X-ray images. And this is a portable X-ray machine used inside the orthopedic OT. Okay, now what is this? This is a traction which was earlier used for the femur fracture. Okay, this is used for the fracture of femur. Now normal neck shaft angle of femur is very important, and here we are talking about the adult age group. So normally the neck shaft angle is between 110 to 130 degrees. Agar it is more than 130 degrees, it is called as coxa valga, and if it is less than 110 or 105, it is called as coxa vera. Okay, remember this is important. Now yahi pe in children or the newborn, the normal neck shaft angle जो होता है, normally it is around 150 to 160 degree. Okay, so coxa valga and vera का जो angle का range होता है, it will be adjusted accordingly. So remember this, very important. Now this is gallows traction, also called as Bryant's traction, which is used in fracture shaft of femur in less than 2 years of age. Okay, and here you can see that the buttocks are clear off from the bed, and the child has to be in this position. So not used nowadays because compliance is very less, and for at least 3 to 4 weeks the child has to be like this. So nowadays the treatment of choice in case of fracture shaft of femur, if undisplaced, you can go for the conservative spica, etc., and if it is displaced, you go for the tense nailing, that is tension elastic nailing system. Okay, called as the tense nail or the Anders nail. Okay, and here the weight that is applied for the traction, it should not be more than 20 kgs. Okay, this is your gallows traction or the Bryant's traction. Very important. Skin traction hota hai. Okay, this is a skin traction. Remember this also, that this is a skin traction. Now this is various fracture of patella. Okay, and remember patella is concerned with the extensor mechanism of the knee, and it is mainly formed by the quadriceps group of muscles. Okay, remember this. So patella में कोई भी injury होगी, it will lead to the loss of the extensor mechanism of the knee. Okay, so it can be undisplaced or two-part transfer, multi-fragmented displays. So two important things that you need to remember in fracture patella. First of all, the cast used here is a special cast called as the cylindrical cast, and the treatment of choice is your surgery. You go for the tension band wiring. But if it is two-part and undisplaced, two-part and undisplaced, you can go for the conservative management, that is your cylindrical casting, or if कम्युनिशन इज वेरी वेरी लार्ज, और मतलब एक समझ लो बोन में बहुत सारे स्मॉल फ्रेगमेंट्स हो रखे हैं, देन यू कैन गो फॉर द पार्शियल और कंप्लीट पटेलेक्टमी ऑल्सो. बट रिमेंबर, कोई सी भी सर्जरी करो, बी इट द पटेलेक्टमी, बी इट द टेंशन बैंड वायरिंग, you have to do the repair of the extensor tendons. Okay, you have to repair the lateral and the medial patellar retinaculum. Okay, so patellar retinaculum repair has to be done. Either you are doing the tension band wiring or you are doing the patelectomy. Remember this about the fracture of patella, very very important. And for viewing the patella, सबसे अच्छे से you do the skyline view, which is like this. So just remember the image and you will be able to answer any question regarding this. Okay, now this is fracture of tibia plateau. Okay, tibial plateau, which are intra-articular fractures, and इसके लिए you just need to remember two things. First, the treatment of choice will be always surgical, and that too ORIF with plating. कोई सा भी fracture in the entire body in any age group you have, and that is intra-articular, that is the fracture line is going inside the joint. डोंट थिंक अबाउट एनीथिंग एल्स. कोई सा भी एज ग्रुप हो, ओपन हो, क्लोज्ड हो, रिड्यूस्ड हो, डिस्प्लेस्ड हो, कैसा भी हो, द ट्रीटमेंट ऑफ चॉइस विल बी योर सर्जरी, दैट टू or if. Okay, remember the treatment of choice will be your surgery. Now, important question. So first thing is this. Second thing that you need to remember is the name of its classification, and the classification, as you are seeing this divided into the 6 types, this is called as your Schatzger classification. Okay, this is called your Schatzger classification. Very very important. Now in case of patellar injuries, you have a index called as insal salvati ratio, insal salvati ratio, or insal salvati index, and it is the ratio between the height of the length of the patellar tendon and the height or length of the patella itself, and normally this is 1. Okay, and if it is more than 1, that means patella is displaced proximally towards the femur, called as patella alta, and if it is less than 1, नीचे है, यानी it is called as the patella baja. Okay, and patella alta is associated with recurrent patellar dislocation, remember. ठीक है, and this is called as associated with the recurrent patellar dislocation, remember this thing. Okay, now what is this? This is bursitis, and this is, देखो 3 बरसास होते हैं, 1, 2 and 3. remember like this. The first one is your suprapatellar bursa. The second one is your in front, that is anteriorly, it is your prepatellar bursa, and the third one is your infrapatellar bursa. Okay, इनमें से as you can see, she is a housemaid, so the front of the knee is traumatized frequently due to the work of the housemaid, so there will be prepatellar bursitis. Okay, so prepatellar bursitis will lead to housemaid's knee. Similarly, infrapatellar bursitis, it generally occurs in the clerks of the church, etc. so this is called as clergyman's knee. This is called as clergyman's knee. Okay, remember this. This is all again very important. Now, unhappy triad of the knee. So सबसे पहले we'll study about the terrible triad or unhappy triad of elbow. Okay, so triad hai, so there will be 3 things, 1, 2 and 3. So firstly, there will be dislocation of the elbow, most commonly posteriorly, most commonly, not always. Then there will be fracture of the radial head, and also there will be fracture of the coronoid process of ulna. And अगर ये तीनों एक साथ है, then it is called as the terrible triad of the elbow. Okay, then this is called as the terrible triad of the elbow. Okay, now in case of knee, it is called as the unhappy triad, terrible triad, or also called as the O'Donoghue triad. It is also called as the O'Donoghue triad, or the unhappy triad of the knee, or the terrible triad of the knee. And इसमें क्या होता है? Always remember that the medial menisci have a attachment, or they are in close relation with the medial collateral ligament. So mostly they both are injured simultaneously. अगर किसी एक की इंजरी होगी, then the other have a very high chances of getting injured. And इन दोनों के साथ में if there is injury of the ACL, that is anterior cruciate ligament also, then अगर ये तीनों की इंजरी है, then this is called as the unhappy triad or the O'Donoghue triad, and it is generally seen in violent sports like rugby players or the football players, etc. And remember, the treatment of choice is your surgery, that is you need to go for the arthroscopic repair of the ligaments of the knee. Okay, remember this again, this is very important. This is your O'Donoghue triad. Okay, now which is this test? This test is your Lachman's test, used for testing the ACL or the anterior cruciate ligament. Remember कि ACL नाम से पता चल रहा है, anterior cruciate ligament will prevent the anterior dislocation of the knee joint, especially the proximal tibia wala part. Okay, so if there will be any injury to this ACL ligament, then the proximal tibia can be moved anteriorly बहुत easily, and बहुत ज़्यादा as compared to the normal range. Okay, so here also in Lachman test, in the image which is self-explanatory, you can very easily see that if by giving this anterior force, if there is movement, then you have the injury to the ACL. Okay, this is your Lachman test. Posterior drawer test for the PCL, similarly anterior drawer test for the ACL. And this is your knee brace, which is used for the ACL or ligament injury at the knee. Now what is this? These two are tests for the menisci injury. Okay, because menisci are related to the rotational stability of the knee joint. Okay, so here you can see, here the rotational stability is checked like this. Just see the image, remember them. And okay, and this is also for the menisci. Here also stability, rotational stability is checked in the prone position. This is called as your Apley's grinding test. Okay, this is called as your Apley's grinding test. Okay, remember the test of the individual ligaments of the knee are important. At least image and the name you should remember. Okay, this is your Apley's grinding test, and this is your McMurray's test. Okay, this test is called your McMurray's test. Now this is your foot drop splint, used in patients of foot drop, and foot drop can be due to sciatic nerve, and sciatic nerve के अंदर भी tibial part और the common peroneal part, the common peroneal part and common peroneal may be or common fibular, peroneal means fibular, the common peroneal may be the deep fibular या deep peroneal or the superficial peroneal. It may be the deep fibular or the deep peroneal nerve is related to the foot drop. Okay, remember this. Now the crescent sign or osteoporosis, sclerosis, cystic changes, collapse of the head, secondary osteoarthritis occurring in this sequence only. It is and seen in the image here. You can see this lucent line here, subchondral line. This is your crescent sign, and these are characteristic features of AVN, avascular necrosis of the hip joint, and avascular necrosis also called as osteonecrosis. And here the treatment of choice if osteonecrosis or avascular necrosis set in is your THR, that is your total hip replacement. Okay, remember. Now there are three important bones that go into the AVN, avascular necrosis, very easily inside the body. First is your femur head after fracture, neck of femur. Then secondly is your scaphoid. Okay, now scaphoid mein you have three parts: proximal 1/3, middle 1/3, and the distal 1/3. Proximal 1/3 is called as your pole, distal 1/3 is called as your tubercle, and the middle 1/3 is called as your waist. And to be more specific, the junction between the proximal 1/3 and the middle 1/3 is called as your waist of the scaphoid. Okay, now remember, most common site of fracture is your waist of the scaphoid, whereas the AVN most commonly is in the पोल ऑफ द स्कैफोल्ड. अगर फ्रैक्चर वेस्ट का है तो भी एवियन पोल पे ही होगा. तो फीमर हेड, स्कैफोइड, एंड द थर्ड इज योर टैलस, एंड इसमें भी बॉडी ऑफ द टैलस इज द मोस्ट कॉमन साइट ऑफ द एवियन. Okay, remember this is very important. And avian of the hip joint के लिए you have a classification called as Fickett and Arlett classification. इसमें आपको बेसिकली दो ही चीज याद रखनी. एक तो फिकेट एंड आर्लेट क्लासिफिकेशन किसके लिए होता है? एवियन ऑफ द हिप. एंड सेकेंडली इसमें ग्रेडिंग के हिसाब से तो जो फोर्थ ग्रेड होगी, here in sorry the third grade, in third grade you will see the characteristic x-ray sign, that is your crescent sign. Okay, whereas secondary osteoarthritis and decreased joint space etc is seen in case of fourth stage, and crescent sign is seen in third stage. Okay, and Fickett Arlett के अलावा modified Fickett Arlett classification भी called as the Steenberg classification. Just remember the name, nothing else. Okay, now what is this? This is a traction used for the cervical injury called as the head halter traction, called as the head halter traction. Okay, remember this. Now this is a traction used for the distal humerus के fracture like supracondylar or transcondylar fracture in the children, and this is called as the Dunlop's traction. This is called as the Dunlop's traction, and this is a skin traction. ओके, whereas इसी तरह का एक skeletal traction भी होता है for the same type of injury in the same age group, and this skeletal traction is called as the Smith traction. Okay, इस skeletal traction को क्या बोलते हैं? इस skeletal traction को बोलते हैं Smith traction. Remember, now this is the normal vertebral body, vertebra, and here this is your anterior part, this is your posterior part. Similarly, this is your anterior part, this is your posterior part, and anteriorly you will have this as the body. दोनों bodies के बीच में you will have the intervertebral disc, and the intervertebral disc is divided into two parts. The outer part is your annulus fibrosus, and the inner part, which is a jelly like substance, is your nucleus pulposus. Okay, so in case of disc prolapse or PIVD etc, what you will have, there will be degeneration of this nuclear fibrosis, so there will be a break or there will be a discontinuity, weakening of this annulus fibrosis, so the nucleus pulposus will go out from this weakened part of the annulus fibrosis, or it will bulge out. This is called as the uh, disc prolapse. Okay, so here you can see now this part here, this is your spinous process, this is your transverse process, this is your body into this is your spinal canal. Okay, and now remember, the body and the transverse process के बीच में this part is your pedicle, and transverse process and spinous process के बीच में this part is your lamina. Okay, you should remember these two things also. This is important, the lamina and the pedicle. Okay, now remember, for if there is any nerve root compression, or if there is any loss in the power, or if there is any motor symptoms, okay, then you need to do the decompression, and for decompression you do the laminectomy. Okay, remember this. Whereas for the fixation of the fractured vertebra, you do the fixation plus decompression. So for fixation, what you do, you do the pedicle screw fixation. Okay, so isliye I was telling you that you should know about the location and the marking of the pedicle and the lamina. Okay, so this we have discussed. Now another important thing is your vertebral arch. So remember, ये जो part होता है बॉडी से पोस्टीरियरली जो भी चीज होगी, be it the transverse process, the spinous process, the lamina, the pedicle, all this is included in the vertebral arch. Okay, all this is included in the vertebral arch. Now in the vertebral column, the important ligaments you should know. Okay, so this is your anterior part, this is your posterior part, this is the body, and this is the spinous process of the vertebra. Sorry. So this is your body, this is your spinous process of the vertebra. So here you can see that body के सबसे anteriorly you will have the anterior longitudinal ligament, and body के पीछे, but in front of the transverse process or the vertebral arch, you will have the posterior longitudinal ligament. Okay, this is your ligamentum flavum, this is your interspinous ligament, and this is your supraspinous ligament. So this is not posterior longitudinal ligament, this is your supraspinous ligament. Remember this, this is important, and this is important why here, because Dennis, this is your Dennis classification. So Dennis classification mein the vertebral column is divided into three columns: the anterior, middle, and the posterior. Okay, so the anterior one here will have, the anterior column will have the anterior longitudinal ligament and the anterior two-thirds of the body and the disc, whereas the middle will have the posterior one-third of the body, disc, and the posterior longitudinal ligament. Okay, and the posterior column will have the other three ligaments and the vertebral arch. So very important, just remember this image. ऐसी जो images है या फिर जो भी image आप देख रहे हैं, just take a screenshot of these images and revise them in 10 or 15 minutes whenever you get, and you have to just see them, and you will save them in your mind, you will remember them. Okay, so इसमें the important thing that you should remember, that this posterior longitudinal ligament is not the part of the posterior column. Okay, it is the part of the middle column. Remember this, this is very important. Okay, now as I've told you disc के बारे में, so yes, there are three stages. First of all, when there will be no break in the annulus fibrosis, only it is weakened, and this nucleus pulposus is not spilling outside the annulus fibrosis, this is called as your prolapse. Okay, but if there is break and it gets spilled off outside, it is called as disc प्रोलैप्स के बाद क्या आता है, डिस्क एक्सट्रूजन, बट हियर रिमेंबर इट विल नॉट breach the posterior longitudinal ligament. Okay, it will not breach the middle column, but in case of sequestration or the disc sequestration, it will breach that ligament, plus the nucleus pulposus will lose its contact with the parent annulus fibrosus, whereas here the parent annulus fibrosus के साथ the contraction the contact is still there. Okay, so remember this, and also degeneration is the first change or the first thing that occurs, which will lead to the prolapse or extrusion or the sequestration. And remember that degeneration occurs of the annulus fibrosis part of the disc. किसका degeneration होगा? The degeneration will be of the annulus fibrosis. Okay, remember this, this is important. Okay, so this is the MR. Okay, this is the normal MR where you can see this. Let me change the ink here. Okay, so this is your vertebral body. This is, these are your spinous process or the vertebral arch. इसमें बीच में this is your spinal canal जिसके अंदर nerves या spinal cord होती है, and this is your intervertebral disc. Okay, now काउंटिंग अगर देखो तो वेरी इजीली, दिस इज योर सेक्रम, सो दिस विल बी L5, L4, L3, L2, L1. ओके, एंड दिस ब्लैक थिंग, इट इज योर एंटीरियर लॉन्गिट्यूडिनल लिगामेंट, यहाँ पे इट इज योर पोस्टीरियर लॉन्गिट्यूडिनल ligament. Okay, so remember this, this is your normal. Now here you can see that here there is bulging leading to the compression of the nerve roots here. So this is your PIVD. Now there are two things that you should remember. First is your conus medullaris syndrome and second is your cauda equina syndrome. So what are these? What are the differences? We'll read them in the coming slides. Okay, don't worry. So degenerated disc, this is your degenerated disc. Okay, bulging, thin disc, and bulging के बाद there will be extrusion, sequestration, and all these are called as the herniated disc. Okay, remember this. Now very important thing is myotomes and dermatomes. So remember what are myotomes and what are dermatomes. So dermatomes are the skin supply or the sensory supply. Okay, uh, like in the hand you will have the तीनों nerves के अलग अलग areas होते हैं dermatomes का, that we have read. Okay, so that is the skin and sensory supply, whereas the myotomes is the motor supply which come directly from a fixed nerve root. So by assessing that concerned function, we can analyze and we can predict that, or we can find out कि lesion is at which nerve root. Okay, so सबसे पहले the cervical region में you have C1, C2, C3, C4, C5 shoulder के लिए, C6, C7 elbow, C8 for the thumb, T1 for the finger adduction, L1, L2 is for the hip, L3 knee, L4, L5 is for the ankle dorsiflexion, and इसमें the most important is your L5, because individually L5 को test करना is very very easy, and most commonly L5 effect is affected in many uh, injuries of the spinal cord. Okay, so L5 को टेस्ट करने के लिए you just need to do the extension of the great toe. Okay, you just need to do the extension of the great toe, and for the S1 you have the plantar flexion, and rest sacral will go for the bladder and the rectum motor supply. Okay, so at least इतना आपको याद रहना चाहिए. अब C6 flexion के लिए होता है, C7 extension के लिए होता है, C4 is for the elevation, C5 is for the abduction. Okay, this you can remember, then it will be very very good, but at least bare minimum you should know the things that I have told you, and इसमें भी the most important is your L5. Okay, इस पे question आ चुका है एक बार, and especially for the INICET this table is very important. Now what is this? This is a sciatica type of pain in case of PIBD, and this is called as, this is looking like as scoliosis, and yes, this is scoliosis, and this is called as your compensatory scoliosis, which is non-structural type of scoliosis, compensatory scoliosis, because here you can see that there is pelvic tilt to manage the deformity or the injury, which will lead to the instability at the pelvis or the loss of the motor supply. Okay, straight leg raising test is important. इसमें आपको basically एक चीज याद रखनी है, अगर 90 degrees of SLR, this is called as SLR, straight leg raising test, 90 degrees of SLR करने के बाद if there is pain, so remember that pain is not due to any that is not neurological or neuropathic pain. Okay, that can be the muscular pain of the back. Okay, whereas Paul's pain, which is a neurogenic pain due to any neurological condition of the spine, and this pulse pain is at the 45 degree. Okay, this is at the 45 degree. Okay, remember this is your SLR, which is very important. Okay, and another important test is your LASIK test, are again useful for any neurological pain or instability after a spinal trauma or trauma to the vertebral column or any disease of the spine. And this is your LASIK test. It is done in the supine position with both knee and hip bend, and then you will gradually extend the knee like this, and if there is pain it is positive, and it will determine that the back pain that is occurring in this patient is neurological. Okay, nerve cutoff sign used previously by injecting dye etc. to see if there is any injury to the spinal nerve. Okay, this we have already discussed. Okay, here you can see कि यहाँ पे this is your almost normal, only a slight bulge is there, but here the bulging is great, so it has extrudated, and there is, and this thing is compressing the nerve roots. Okay, now we'll study about ki what is conus medullaris and what is cauda equina etc. So the thing is that ki, see, at the level of L1 or L2, upper border of the L2 and lower border of the L1 पे, the spinal cord terminates like this, and then only a thread like part of the spinal cord remains. This last part, this is called as your conus medullaris, whereas this entire part is called as your phylum terminal. And now it has two parts. This is your S2. Generally at the level of S2, this part is still enclosed, as you can see in the dura mater. Okay, all the meninges are there, dura mater, arachnoid and the pia mater. So this is called as your phylum terminal internum, whereas this distal most part mein, here you can see ki only the pia mater will be left, whereas the dura mater and arachnoid bhi nahi hoga. So this part is called your phylum terminal externum. Okay, so यहाँ पे conus medullaris के बाद only a thread like part is left. That's why after below the level of L2, generally at the between level of L4 L5, you do the lumbar puncture. Okay, because there will be less chances of injuring the spinal cord. Okay, remember this is very important. Okay, नाउ ये तो हो गया नॉर्मल एनाटॉमी की एक्चुअली में व्हाट इज कॉनस मेडुलरिस. नाउ व्हाट इज कॉर्डा इक्विना. द थिंग इज दैट फ्रॉम दिस part from below, what you have the many these nerve roots like this, so these are called as the chorda equina, like horse tail. Okay, So now we'll have the differentiation between conus medullaris and cauda equina. So remember, conus medullaris में signs and symptoms will be often more and the prognosis will be worse as compared to the cauda equina syndrome. So obviously conus medullaris क्या होगा? If the lesion or the PIVD, prolapse, extrusion, etc. is above the level of L2. ओके, सो L1 L2 के लेवल पे होगा तो कॉनस मेडुलरिस, एंड उसके नीचे पे अगर बहुत ज्यादा इंटेंस नर्व कंप्रेशन है देन इट कैन विल लीड टू द कॉडा इक्विना सिंड्रोम. ओके, तो साइंस सिम्टम्स आर मोर इंटेंस एंड वर्स इन केस ऑफ कॉनस मेडुलरिस, सिर्फ एक चीज को छोड़ के, दैट इज योर रेडिकुलर पेन और द न्यूरोपैथिक न्यूरोलॉजिकल पेन, and this radicular pain is more severe in cauda equina syndrome and less severe in case of conus medullaris. Rest all symptoms ज्यादा होंगे conus medullaris में. Okay, so conus medullaris is bilateral and sudden, whereas this is gradual and unilateral. Lower back pain will be more, and the motor strength or the motor loss will be symmetrical, whereas it is asymmetrical here. Ankle jerks are affected, and in cauda equina both ankle and knee will be affected. Sphincter, the anal sphincter and the urethral sphincter, these will be affected early in case of conus medullaris and late in case of cauda equina. And conus medullaris mein there will be more chances of impotency. There will be more chances of impotency. In cauda equina mein you will have the saddle anesthesia etc. in the perineal region. Okay, now what is this? This is your internal gibbous. Okay, so ये ध्यान रखना है. I'm telling you a very simple rule of law. The rule of law where you this you can use it in solving any type of question is that agar if there is any disc prolapse or disc herniation, or if there is any fracture of the vertebral column or the vertebra, in these both the cases the pathology, anything will be on the posterior aspect of the vertebral body. Remember this. Whereas in case of pot spine tuberculosis of the spine, remember everything jo hoga ye sara, it will be on the anterior side. Okay, so the anterior side mein there will be lesion. Here you can see this is your anterior side, this is your posterior leading to the angulation, and this is called as your internal gibbous. Okay, this angulation, this is called as your internal gibbous. Here you can see very easily this is your internal gibbous. Okay, so now these two images are very important. Let me mark them as first, and this is your second one. Okay, now what is this? This is called as, here you can see sacrum ke andar L5 have been incorporated. L5 is looking like part of the sacrum. So this is called as sacralization of the lumbar vertebra. Whereas इसका opposite जब sacrum यानी S1 looks like a L5, okay, not fused with the rest of the sacrum, this is called as lumbarization of the sacral vertebra. Okay, so इसमें you need to remember one thing, and you need to remember that कि अब इसको कैसे you will diagnose. So excuse me. So कैसे you will diagnose? So for diagnosing it, that's why we never count the vertebra from the sacrum. We always, in any scan, CT or MRI, you count the vertebra from the cervical part only, because of the sacralization and lumbarization wala phenomena. Okay, so remember counting always starts from the cervical region, and वहां से you come downwards after counting the entire cervical, thoracic, lumbar and spinal. Okay, so remember this. Now lumbar lordosis, this is your lumbar lordosis, and this is your cervical lordosis, common, you know all about it. So these are the various spinal deformities. Okay, this is your swayback deformity, you can see. This is your exaggerated lumbar lordosis. This is your forward bending, is your kyphosis. Okay, and this is your this posture, good posture. The forward bending is your kyphosis, whereas sideways tilt or the S-shaped tilt, it is your scoliosis, as image that we have seen previously. You can see there also. Okay, so what is this? This is your fracture of the vertebral column. Okay, so here it is. Okay, so yes, this is the fracture of the vertebral column, and here you can see the vertebral body में fracture, and this is a compression fracture. This is your compression fracture. Here you can see, because the entire vertebral body is not fractured and the spinous processes and the posterior part is intact. Okay, now here the spinous process is intact, posterior part is intact, but the body is broken entirely. This is your burst fracture. Okay, this is your burst fracture. And this, where the spinous process is also involved with the vertebral column, this is the worst prognosis type ka. This is called as your chance fracture. Okay, this is called your chance fracture. Okay, so remember the images are very very important. These are the Crutchfield wrong traction. Okay, just remember the name and the image, that's it. इसके अलावा और कुछ भी नहीं. Okay, yes, this is fracture of the atlas vertebra. Now C1 is your atlas, C2 is your axial, and C1 vertebra का fracture होता है of the this anterior part and the posterior both. This is called as your Jefferson fracture. Okay, this is called as your Jefferson fracture. Remember, C1 atlas fracture, Jefferson fracture. Okay, this is your मिल्वॉकी ब्रेस. ओके, नाउ D1 T1 फ्रैक्चर का जो स्पाइनस प्रोसेस, T1 वर्टिब्रा के स्पाइनस प्रोसेस का फ्रैक्चर इज कॉल्ड एज योर क्ले शॉवेलर्स फ्रैक्चर. Here you can see the pedicle screw fixation is done. Okay, this is your pedicle screw fixation that we have read. I have told you about it in the previous slide. This is your pedicle screw fixation. Okay, now Tillich's classification, Dennis, we have read. Tillich's classification is very important because it depends ki whether surgery has to be done or not. Okay, so it is आपके काम की चीज ये है कि it is dependent on three factors. First of all, the morphology or the type of the fracture, it is compression, burst, chance, etc. or the PLC integrity. What is PLC? Posterior column integrity, ki posterior column is affected or not. And the third is your the neurological status of the patient. And here you can see that there are gradings, and 4 से ज़्यादा is always surgical. If it is 4, it is surgeon's choice. इतना डीप में नहीं जाना, just remember Tillich's grading किसके लिए होती है and किन 3 criteria पे it is dependent. Okay, just you should remember this. Okay, now we will see about the spinal deformity. उसमें firstly we will study about the scoliosis. Okay, so scoliosis में here you can see this is the typical clinical features of the a scoliotic patient, that the head will not be in the center of the body and one shoulder will be higher than and prominent than the other, and also there will be this abnormal gap between the arm and the trunk, and spine will be curved obviously with one hip more prominent, yani there will be pelvic tilt to support it, so there will be pelvic tilt. Okay, Here you can see. Yes, now one important thing that you should know about the scoliosis. Okay, I'll tell you here. Scoliosis is of two types. First is a non-structural scoliosis, which can be due to postural defect or the compensatory, like in the PIVD, sciatica, etc. And second is your structural scoliosis. Now, structural scoliosis is of two types basically, the idiopathic one and the congenital one. Congenital नाम से पता चल रहा है कि it will be from the birth. Idiopathic can occur at any ages, any age. Most commonly it is in the adolescent age group, and the most common type is your idiopathic type. Okay, now in congenital scoliosis में क्या होगा? In congenital scoliosis, in every case you will have certain deformity of the vertebral column or the certain deformity in the development of the vertebra, which will lead to the curvature of the spine. Okay, so that vertebra deformity can be of two types. First of all, if there is any formation deformity, like only failure of formation hai. Actually what happens is that the two parts of the vertebra fuse to make a single body of the vertebra like this. Okay, so if there is partial failure of fusion, then it will be called as a wedge vertebra like this. And if the both the parts are have failed to completely fuse, yani ek to what happened that there will be only one part of the vertebra. Okay, then this is called as your hemivertebra. This is called as your hemivertebra, नाम से पता चल रहा है. Now if the fusion में, if only there is unilateral failure, this is called as your congenital bar. And if there is bilateral failure, it is called as your block vertebra. So नाम से ही पता चल रहा है एक ही तरफ की vertebra है fully developed, then it is called as your hemivertebra. But vertebrae are different, but posteriorly they are fused with each other. This is called as your congenital bar or bar vertebra. And anteriorly and posteriorly also there is complete fusion of the vertebra, and there is no intervening space between the adjacent vertebra. All are fused completely. Then this is called as your block vertebra. Okay, then this is called as your block vertebra, remember. So here you can see hemivertebra with block vertebra. Okay, this is your hemivertebra. So failure of formation में you can have the wedge vertebra or the hemivertebra, and failure of segmentation में you can have the bar, unsegmented bar, or this block vertebra. Okay, remember this. And most common type of deformity that is seen is your mixed. Okay, mixed hota hai most commonly, remember this. Now scoliosis on the basis of the position of the curve, it can be thoracic or lumbar or thoracolumbar, and thoracic is the worst prognosis wala scoliosis. Worst prognosis wala scoliosis is your thoracic. Okay, remember, worst prognosis wala scoliosis will be your thoracic one. Now, in case of thoracic scoliosis, you will have this abnormal elevation and prominence of the rib cage of the affected side, and this is called as your rib hump. Okay, this is called as your rib hump. इसको क्या बोलते हैं? This is called your rib hump. Now, one important thing that you should remember कि scoliosis में there will be curve. So वो curve कब तक होगा और whether to operate or not. Okay, so that depends on whether the curve is still progressive or not. Okay, and how we will decide whether the curve is still progressive or not, it is very simple, and it is a very common thing. एक बार समझ लोगे तो कभी नहीं भूलोगे. See, if this skeleton is a growing skeleton, that means there is a growth of the skeleton is still left. So obviously skeletal system and the vertebral column will grow, and all this will lead to the increase in the curvature of the scoliosis. But if the normal growth curve of the patient is has happened and it has stopped, so obviously there will be no growth of the skeleton, so the curvature of the vertebral column or the scoliosis will not be exaggerated any further. Okay, now how we will see that the vertebral column का the skeletal growth is remaining or not, तो उसके लिए you have to see one important thing which is called as the iliac apophysis. Okay, so iliac apophysis में क्या होता है, this is your black line. Okay, see, तो जितनी बड़ी ये black line होगी इसका मतलब है कि उतना ही ज़्यादा the skeletal growth is left. Okay, so research 4 or 5 means the skeletal growth is left अभी बहुत ज़्यादा, whereas this research 1 or 0 means skeletal growth is almost over. Okay, so remember this research score is used for this purpose. And another important thing in scoliosis that you should remember is this Cobb's angle between the end vertebrae. What are the end vertebrae? The first and last vertebra of the major curve. Okay, so this Cobb's angle, now this Cobb's angle, if in general terms, if it is less than 30 degrees with research score 0 or 1, then there is no need for the surgery. Okay, then there is no need for the surgery. So you should remember this is very important. ठीक है, Cobb's angle किस किस के बीच में होता है? There was a direct question on Cobb's angle at the in the NEET PG 2022 जो मैंने दिया था, and there was direct question, direct one liner angle दे रखा था. Okay, so remember this is important. Now we have seen this. Now सर्जरी में क्या करते हैं? In the surgery of scoliosis, we do the fusion of the vertebra. Remember, we do the fusion. Now नॉन कंजर्वेटिव मेथड्स में there are different types of braces, उनके नाम आपको याद होने चाहिए. This is your Milwaukee brace, scoliosis and kyphosis दोनों में यूज होता है. This is your Boston brace, also used in both condition, but it is more cosmetically beneficial and cosmetically superior than the Milwaukee brace. Now this is your Reisner's turnbuckle brace. Okay, just remember the images, and this is your localizer cast or the localizer plaster, and the operative methods is the fusion. And earlier what you there should be pre-operative traction ताकि at least जितना correct हो सके pre-operatively you correct it, then you go for the surgery. So this is your collateral traction. This is called your collateral traction, and these are the now post-op rods or special implants that are put to keep that correction into the place. Okay, this is your kyphosis, the forward bending. Here you can see the forward bending. This is the kyphosis. This is called as the rounding of. Okay, now the bending of the vertebral column जो होता है इसमें there are three terms: knuckle, angular kyphosis or the angular gibbous, and the round kyphosis or the rounding that we have seen here. So if there is only one vertebra involved, it is called as your knuckle. If two or three vertebrae are involved, it is called as your angular gibbus. So in the port spine के अंदर जो अपन ने देखा था, the internal gibbus in case of port spine, it is your angular gibbus, where two or three vertebral bodies are involved. One हो गई तो knuckle, and अगर more than three vertebral bodies are involved, it is called as your round kyphosis. Okay, this is called as your round kyphosis. So here you can see only one vertebra is involved, so this is your knuckle. Okay, and another important thing related to the scoliosis is your Schurman's disease. So there will be, sorry, kyphosis. So there will be thoracic kyphosis, but remember there will be intense pain and sometimes tenderness also at the apex of the curve. So अगर kyphotic curve के apex पे there is intense pain etc., then this is your Schurman's disease. बस इतना ही याद रखना है, इससे ज़्यादा you don't need to remember. Now what is this? This is kyphosis. Okay, मान लिया this is your kyphosis. Okay, but which disease? In the x-ray you can very easily appreciate the disease here. Which disease is this? Okay, this is your ankylosing spondylitis. Here you can see that the bony ankylosis has set in. The bony ankylosis is set in bamboo spine, and इसके अंदर last stage of this ankylosing spondylitis में the last stage में you will have the kyphosis. So ankylosing spondylitis, very important. This year also 3 questions were there in the NEET PG from the ankylosing spondylitis. So I always tell you that ankylosing spondylitis आते ही आपके दिमाग में 2 चीज क्लिक करनी चाहिए. The first is your, it is HLA B27 positive, and secondly bamboo spine or and the dagger's sign. Okay, age group young men 20 to 30, stiffness, bony ankylosing होगा, start with as enthesitis, and the most common of the first joint is the sacroiliac called as sacroiliitis. Okay, so that was all about today's lecture. Okay, we'll see the rest of the slides in the next lecture. Also I'm not well today also, so we'll see the next of the slides in today in next lecture. Okay, so thanks for watching. Study hard. Last 5 days, almost only 5 for the INICET. It is crackable, easy. Just do the revisions, do lots and lots of question, and previous years MCQs, very important. Okay, so just remember them. The previous year MCQs are very important. So thanks for watching my lecture. What happened here?